Right? Cut this off. Cut this off so you just have a soft tube. Thread this through here and put it, behind their neck. But this will dig into your skin if you're fat at all. These are super. And you just wash them. So don't throw this away. Just take it over when you're done and rinse it out. But I've got this ready. Now, if I was going to do it the old-fashioned way, or if I needed to do some cleaning, what you can do is you can have a basin with some water. I put some sterile water in. Now, in this basin, I'm going to put half water and half 3% hydrogen peroxide. Don't use straight peroxide because it's irritating to the skin. Mix the peroxide half-half with water, and then it will clean up. It denatures protein, so it'll help you get the mucus and crap off, but it won't. That way it won't hurt their skin. We use straight peroxide. And there's another debate about this. One camp says dry dressings, and the other camp says wet dressings. So wet dressings sound like it might make an infection. It's actually better, but we're still using dry dressings for people old-fashioned. But when it's a brand new trach, if you take if you soak that in sterile water or saline and put it on there, it doesn't adhere to the wound. If it's a fresh trach and you pull, there'll be blood and stuff. So if it's all stuck in the wound, you're gonna need to take some water on the Q-tip and put it on there and soften up the clotted blood, because if you just pull it off, they'll start bleeding again. Okay, so what have I got? I've got my next, I've got that, I've got the tie, I've got that stuff. Oh, these things. If you were doing this as sterile, this is sterile scissors. Sterile tweezers. These are actually really good tweezers. They look crappy, but steal these and use them at your house. I'll give you all a kit. Okay. So what this is for is reaching under here and pulling you can pull these without touching. You're trying not to touch. So now, if it was the olden days, what you do is you take out the inner cannula, which is not disposable, and you would drop it into the peroxide to start soaking, to loosen up the crusty mucus. And then, it's not disposable. I don't have an extra one. So he's sitting there breathing through his outer cannula. Now this guy, what we're gonna do is take this out and throw it away. Disposable. In fact, it'll say on the package, DIC, disposable inner cannula. Disposable inner cannula. So, and it's a 6, I got a 6, which goes with the 6, because if you get the wrong one, it won't fit in there. Okay, so if it was an old Jackson trach, you'd throw this in here, and you'd take this like this, and you'd scrub it out, When you get it all scrubbed out, you'd take some sterile water and pour it over it to wash out the peroxide and the mucus, and then you'd be done, and you could put this back into the patient. Fine, that's nice. Let's not do that. Okay, so for now, the modern way. Okay, I can still have water and peroxide. I need Q-tips. I don't necessarily have to have tweezers, but these kind of things are really handy, like gauze. So here's the deal. This is dirty. Okay, so what I would normally do is I would pull this stuff out, get the inner cannula, pull this out. Now, wastebasket or floor. It's dirty, get rid of it. I can clean it up later. Right? Usually I'll bring the wastebasket over, but I forgot, so I'm gonna do the procedure, I'm throwing it on the floor. If he's on a ventilator, what I have to do is as soon as I take the cannula out, I put the new one in and hook him back up to the ventilator, because I can't attach the ventilator to this thing. But let's say he's just he has this. He's a regular trach guy. Yeah. So I took out his dirty stuff and threw it away. If it's a fresh trach, I now take off the dirty gloves and put clean gloves on. In the old procedure, you put sterile gloves on. So you would do like this, go up here, pull this stuff out, take the inner cannula out, right? Then put on sterile gloves and do the sterile thing. But what I would do nowadays is I would just take off these gloves and put on a pair of clean gloves. So I put on my clean gloves, and I'm ready to do this. Let's look at the wound.
Oh, you don't need...
I'm wearing safety glasses, dude. Let's look at the wound. What am I looking for? What do you look for in your own personal wounds, Bryce?
Puss.
You like them to heal up nicely? Yeah. How do you know when they're not healing up nicely? What do you see in a wound when it's not healing? Pus. White. Oozy stuff. Redness. Redness. Swelling. Yeah? The tissue swells, it looks red. Yeah, inflammation, which is okay to have some of that as part of healing, but you can tell if it's starting to get really red. Now the pus you have to watch out for because it could be coming out of their trachea, right? If they have a lung infection, but otherwise, if they don't have a lot of secretions and they start to get pussy, then it's getting infected. So the purpose of wound care is to prevent infection. So here how's it goes. Okay, now this is my sterile stuff again. I got the inner cannula. Throw it away, right? Now I'm going to take my Q-tips or my gauze. If there's a lot of snot and stuff, take the gauze and wipe it off. Now here's the thing. This is the incision, so this is clean and this is dirty. So you take it and you go like that and you wipe it, right? Otherwise, if it's just a little bit, dip this in the peroxide like this and go in here like this and go from clean, I mean, this is clean by the incision, out to dirty. Throw that away. Dip this in here. If that's done, that's done. If I need to do more, I'll do more. Now come on this side and clean out to dirty. Not this, not, right? It's from the center of the wound out and then out. Okay, now there could also be crap on the flange, you know, dried snot and stuff. So I'm gonna get this all cleaned up. I want this to look nice. When the neck is all cleaned up, and I've done all my Q-tip stuff, then I have a choice. I can put the new dressing on, or I can put the inner cannula in. It makes no difference whatsoever, does it? But these things can be tricky to put on. Oh, what about the ties? I only change this if it's dirty. If it's clean, leave it alone. Because once you unstrap the trach, if they, remember it's little, they can cough and it'll fly out. They just go like this, and the thing will fly out. Then if it's a fresh trach, the stoma will snap shut and then they will have airway obstruction and die. And you'll feel really bad if that happens. So then you can do it with two. If it's a fresh trach, I get 2 people. If it's an old trach, it forms a tract. The thing will fall out, and the hole will just be in your neck. Okay, so if I'm by myself, so what I'm gonna do is I'm gonna unstrap this. What I could do if I'm by myself, I really like to do this, if I'm by myself, it goes like this, doesn't it? Yes. Yes. Okay, so I'll put this one under his neck, so my clean one is ready to go, right? Hey, let go. Okay. Real people, their neck holds things down. If I'm by myself, I'll unstrap it, right, like this. I'm keeping a hand on the trach, see? If it's a fresh trach, I can't allow the trach to come out. The patient will die. Oh, my other one came back out. Oh, that happens. It's hard to do this stuff by yourself, yeah? That's okay. Who cares? Okay, so now I gotta start over. The only bad thing about these, you gotta remember, it's the shiny side up.
Shiny side up.
Well, you know what I mean about the Velcro? Okay, now, I prefer not to restrap the trach yet, because it's much easier to get this in here. The flange wiggles a little bit. And oh, and you're cleaning, you gotta go like this, and you know, you gotta look under the flange, you know, like, wash behind your ears. Okay, now, this, if there's no tape in the way, or ties in the way, you just bring this up one side at a time, works best. So get it up under one side, and then get it up under the other side. If you're trying to be sterile, use the tweezers to do it. I don't worry about that. Okay, so that's that. I'm gonna come up under here, and I have to lift the flange a little bit. Get that through there. Right? This one through here. And this is very uncomfortable for the patient.
Wow.
Because you're gonna cough. Now, what other procedure might I have to do? Suctioning. Because if you start doing this, and you don't suction them, then when you touch their tube, they'll cough, and they'll cough a bunch of crap out onto your clean dressing, and you have to start over. So you always gotta clean out their lungs first, so that otherwise they'll mess up your dressing. Right, okay, so that's strapped in place. That looks okay, that's fine. Inner cannula. Oh, here, why don't you put this in? Just pull the tab. Pull that little tabby thing there, the top part. There's a little, yeah, it's always hard. So before you start this procedure, you have to make sure you have all the equipment. Don't ever get started on this and then, okay, so yeah, grab it by that, okay? Now, it goes straight in, but sometimes it's easier to go like that and then turn it. Okay, once it's in there, grab the little clampers and get them down onto the, no, I gotta go further down, right? Now, why isn't this working? Because it's the wrong inner cannula. This is an inner cannula for a different Shiley trach. Notice this one has a twist.